Good morning, everyone. I just wanted to give you an update what's been going on with me. I went to an MRI appointment, as you know, on Sunday to check the imaging of my breast to see if anything's changed in the lymph node area based on my February MRI, because the surgeon is recommended that I had another MRI before she actually goes in and do the surgery. She wants to make sure she's familiar with my body because, as you know, she's my third opinion. So the other thing, I actually have went to my cardiology appointment. I thought it was scheduled for Tuesday, showed up and everything, and it was not my cardiology appointment. I was supposed to be at my eye appointment, and so I showed up at the cardiology appointment, and my cardiology appointment was on Wednesday. So anyway, I went to the cardiology appointment, and the cardiology appointment went well. And the cardiologist would like for me to do an echo, so I have an echo on May 2nd, and she wants to look at my heart and compare it to my last echo to make sure there's no changes, because you all know I've been in and out the hospital for my heart due to the SVT complications from the chemotherapy, because when you are on chemotherapy, your heart enzymes get elevated, blood pressure and dehydration can play a major role in your SVT if you suffer from supraventricular tachycardia. So she wants to make sure that my heart is fine before going on the surgery table, which is very important. So I'm going to have that echo May 2nd, and then I'm going to meet with the radiation oncologist next week to go over radiation treatment after surgery, because they said I will need to have a little bit of radiation. So hopefully I don't have to do it for a long period of time, with my mass being 0.9 centimeters that is in the breast. So it was 5.7 centimeters when I was diagnosed with cancer in August, but it's 0.9 centimeters. So it's very, very small. And anyway, and I also am going to meet the plastic surgeon, because with my breast being 36D and I'm small up in the breast area, the surgeon said the problem with doing a lumpectomy is she wants to make sure that it doesn't show a lot of scar tissue and won't be any problems. So she needs a plastic surgeon to be present to probably, do some extra things to make it look nice. So I do agree with that. And I'm going to meet with them next week. And as far as my side effects that I've been having with coming off of the chemo, 1 month, amen, no, a month and a half. February 12th was my last day of chemo. So yeah. I have had no other problems other than chemo neuropathy in my arm, my legs, my toes, my hands, my fingers. Nails are popping halfway off, not fully off, but halfway off, because as I told you, my nails are separated from the nail bed. And what else? I'm giving you an update on everything that's going on, because at first I was on here quite often, but I've been making some big changes because, I have an online business. So, and also I've been working modified at my part-time job, and I'm trying to transition into another position with my part-time job. So anyway, let me get back on track here, because I love to talk and long-winded. But I wanted to show you how I eat. Some of you all been asking, what is it that I eat, since I don't eat animal food anymore as far as meats. I stopped eating chicken, turkey, and I just recently stopped eating fish, because when I met with my integrative medicine doctor, she gave me information how mercury is in a lot of the fish that I like, and I love crab, I love shrimp. So I gave it up, not eating seafood anymore. I'm trying to live a healthy life. So I have children, and my mom passed when I was 20. She was 52. She had cancer in her lungs and kidney, and she had originally breast cancer and had a mastectomy. And 2 years later, the cancer came back, and she was 52 and she passed. So I don't want to go through that experience, although, things can happen, but I'm just trying to do things right. Change that in the family. So anyway, I'm going to show you what I'm eating, and I'll be back on here giving you an update about my visit with the radiation oncologist. And like I said, that's going to be next Tuesday. And you all have a wonderful day. Let me show you what I eat. So I love my food blackened. So I have 100% whole wheat pancakes. And also I have organic eggs with tomato cherry. And also asparagus is inside of it. And I also have my smoothie that I made. And the smoothie consists of spinach, and it has apple juice for the sweet flavor, and also it has some soursop leaves, and also it has turmeric and ginger, because as you know, I swell a lot from the chemoneuropathy, and turmeric removes inflammation in the body, as I've been saying. So I'm trying to do the healthy approach to avoid taking medications, because it's been recommended with chemoneuropathy to take Gatapin for the pain and the discomfort. And, you know, medications have a lot of side effects. So I also use glutamine, which is a powder form. I add that into my drink, and actually I haven't had none of that in a while, so I'm going to add that in my smoothie that I made. And that helps out a lot. Like if you have pain, it like goes away. So my sister-in-law had told me about that, and that was just one of the great ideas. I also have been told that you can use ice, and so one of my good friends, she gave me these ice packs to use that you could put on your hands and on your feet. I haven't used it because I can't comprehend how that's gonna help. I have my relief by taking hot baths. When I take hot baths, or if I have a pedicure or get my nails done, the tenderness and tingling subsides as well. And after I take my hot baths, I normally go to bed and I feel fine. I wake up the next day, the swelling and everything is gone. This is after working a long day. So there you have it. And I feel really good today so far. And one other thing I wanted to let you know is Easter weekend, Resurrection Sunday tomorrow. So don't forget that we have 25% off site-wide, and you can get your clothing. You can also get handmade or custom-made jewelry by lrgsjewels. If it's something in particular that you would like to have handmade or custom-made by lrx, you can click the button for custom-made jewelry, and she will do a consult with you to make sure it's something that she can do. And also, we also have free shipping. Use the code 4 years. We've been in business for 4 years now, and I'm just trying to, you know, put 100% into the business again, get better items, because I'm going to be doing away from products that are coming from China and just work with the U.S. strictly. I have been talking about this for 2 months, but our president keeps changing the tariff situation. So once things have changed, I will just be getting items here in the U.S. and no longer doing things outside of the U.S., because it's going to be so much money if that's going to be the case. So have a wonderful, blessed day, and I'm going to show you my food. So this is my smoothie. This is the pancake, and this is my eggs. So don't judge. That's the way I like to eat. Have a good day. Bye.